Alright, in this one we're going to be focusing on some parasites and then antiseptics and disinfectants. Probably the most important parasite that we can talk about, at least the one that kills the most humans annually, is going to be malaria. So malaria, you become infected by the pathogen, which is a plasmodium. There's a handful of different species of plasmodium, and a lot of them act a little bit differently and can give you different types of malaria. So it's all about how long it takes them to express out of the liver and then lyse the blood cells, and you get these cycles of fevers and chills and feeling better, and then getting worse and feeling better. And then there's also one that goes dormant, and so you can get repeat infections when it comes back out and whatever. There's a bunch of different types of plasmodium out there. Mosquito bites you, you get infected, they come to your liver where they mature. The adults come out, feed on the hemoglobin in your red blood cells, and lyse out of that, and then get eaten by another mosquito, where they can reproduce and make more babies to infect the next person, right? A lot of your anti-malarial treatment is going to be prophylactic. It's going to be, okay, you're going to an area that has a lot of mosquitoes that potentially can be infected with these plasmodium. You're going to take these drugs before you go so you don't get infected by that, right? The ones that have asterisks by them are also used during acute attacks. These are only for acute attacks. You don't use these prophylactically. The first one we'll talk about is your primamethine. This is going to be a competitive inhibitor for a dihydrofolate reductase. So these plasmodium make their folic acid versus us, where we get ours through our diet. And so they will convert that folic acid into folinic acid to use it. And so your primamethane actually stops that from happening. Your quinines, like chloroquine, hydroxychloroquine, these work by, so when they eat the hemoglobin, when they metabolize it, they go from a hematin to a hemazoin. This hemazoin is a lot less toxic and can be excreted as metabolite, while the hematin is very toxic to the plasmodium and then builds up in them and kills them. With your quinines, you can get cinchonism. Quinine was first discovered from the cinchona tree in the Andes Mountains. If you get too much quinine, that's when you get your cinchonism, and it's just a lot of central nervous system stimulation. You get ringing in the ears and headaches, but that stuff goes away like when you discontinue use of it. Primaquine can cause hemolytic anemia, especially in people with glucose 6-phosphate dehydrogenase deficiency. This is typically found in Caucasians. And so if you're a Caucasian, you might want to get checked before you take primaquine. Mefloquine is cardiotoxic, especially when given with other quinines or beta blockers. And then mefloquine and primamethamine can cause Stevens-Johnson syndrome. Stevens-Johnson syndrome is going to be an inflammatory response to where the skin and the mucous membrane start growing lesions in them, just due to that inflammatory response. Kind of funny story, when the British went over to India to colonize it, a lot of them started drinking gin and tonics. Tonic water has quinine in it. And so the Brits were basically preventing themselves from getting malaria by drinking gin and tonics, which is just really funny to think about. There are some drugs that we didn't talk about, and there are your artemisinin are derived from an ancient plant in China. And the Chinese have been using artemisinin instead of quinine as their anti-malarials. And nowadays, quinine's kind of like going out of style because a lot of the plasmodiums are becoming resistant to it. And so your artemisinin are kind of coming on board to help prevent malaria. You can read about that more in like the supplementary stuff. All right. So moving on to dysentery. Dysentery is just when you ingest something that is contaminated water, contaminated food with protozoans, either Entamoeba histolytica or Giardia lamblia. What you see with dysentery is gastrointestinal inflammation, lots of diarrhea, really painful abdominal cramps. And really the drugs that are the go-to is going to be your metronidazole. Wow. Let's try that again. Your metronidazole. Also tinidazole. Paromomycin, and your tetracyclines. They work against Entamoeba because it is an amoeba and it feeds on bacteria in your GI tract. And so if you kill the bacteria using antibacterials, then you can starve out the protist. But with metro and tinine, with your metronidazole, also any of your azoles, you'll see them forming highly reactive anions. They're going to target the DNA, specifically pyruvate, ferrodoxin reductase 2, which your anaerobic protists are going to be using. And so you can attack these anaerobes using metronidazole. So metronidazole is really good at attacking these anaerobes. Side effects of these things, kind of your typical side effects, especially for GI stuff. You're going to have headaches. You're going to have nausea, vomiting, potentially dry mouth. As we mentioned a couple back, metronidazole can cause disulfiram-like effects. So if you drink alcohol with this, you can end up getting really sick. Lots of nausea, lots of vomiting, really intense headaches. Even if you get just like a little bit, like in cough and cold syrups, like NyQuil has alcohol in it, it can make you really sick. So if you're on Metron, don't drink alcohol, right? Another side effect is it can cause vaginal and urethral burning. Both Metron and tinine can cause that. If the person is pregnant, you don't want to give them either of these because they can cause genetic defects. Instead, go ahead and go with paromomycin. All right. On to two more. Toxoplasma gondii and Trichomonas vaginalis. Toxoplasma, this is one that you can get from cats. It uses mammals as a host, enters the macrophages, travels throughout the body, likes to deposit its oocytes in your feces, and so the mature ones will be in your intestines reproducing, making eggs. Then you poop them out. If you have toxoplasma in your first trimester of pregnancy, it can cause a spontaneous abortion. If it's later on, it can cause birth defects. In you, if you just get it and you're not pregnant, it can cause a mild malaise where you're just like, man, I don't feel good. It can also cause muscle pain and low-grade fever. So it's kind of like having a pretty weak type of the flu. You treat it with primemethamine and a sulfonamide. With the trichomonas, this is a sexually transmitted disease, or STI, sexually transmitted infection. In males, it's almost always asymptomatic. In females, it can be typically asymptomatic, but it can cause pungent discharge from the vagina. Also intermenstrual spotting and vaginal itching. Again, treat it with either metro or tinine. Knocks it out. Kills those anaerobic bacteria. We will pick up with anti-helmet drugs in the next one.